knee replacement surgery with the use of or robotic knee replacement. For last 2 or 3 years, robotic knee replacement has come up really very fast. This is further modification of computer assisted navigation knee replacement. In robotic knee replacement, there are two types of robots. One is robotic assisted arm and the other is completely robotic knee replacement. The first and foremost advantage of robotic knee replacement is the cutting of the bone which is required at the time of knee replacement is almost 100% correct, because pre-op CT scans are fed into the robot and robot make actual calculations of how much to cut, and robot will cut that much part of the bone only. So the precision is almost perfect. The fixing of the implant doesn't require manipulation because the cutting is in sync with the implant size. The fitting of the implant is very easy. The alignment of the joint is almost 100% because again the axis is calculated by the computer in the robot and accordingly the cuts are taken. The disadvantages, or I would say the problems which can occur with robot is it is very difficult to carry out a robotic knee replacement if patient is having osteoporotic femur or osteoporotic tibia, because the marker pins need to be inserted in the femur and tibia and it can cause fractures. Second thing, robotic knee replacement can take a little bit longer as compared to normal knee replacement as there are more steps involved. Third is robotic knee replacement is a bit more expensive than normal knee replacement. But as things are progressing, robots are improving and robotic knee replacement is the future in knee replacement surgery, or I would say for any joint replacement surgery. Thank you, Dr. Ajay Randive.